Welcome back to the Ed Show. Thanks for watching tonight. Republicans want Democrats to do their dirty work when it comes to Medicare. We already know President Obama offered $400 billion in cuts to Medicare and other entitlement programs over the next 10 years. Here's Andrea Mitchell trying to get an answer from House Republican Jason Chaffetz on where he has a problem with it.
What about his $400 billion in Medicare? Is your problem with it that it's not specified? Do you want to see a more specific laundry list, or do you have to produce a laundry list before he's going to come up with his? Is this a giant game of chicken?
Well, and that's what's unfortunate. That's what I think the party should be sitting at the table. I think Speaker Boehner is on the absolute right track. I think he's shown a willingness to be able to talk about things that we haven't been able to talk about before, and they need to sit down and go to hash this out.
Isn't that interesting? Republicans won't answer the direct question because these aren't the kinds of cuts that they're really looking for. In an interview with the Wall Street Journal, Senate Minority Leader Mitch McConnell offered his wish list: higher health care, Medicare premiums for the wealthiest Americans, and an increase in the Medicare eligibility age. He also wants to slow the cost of living increases on Social Security. Now, obviously, Social Security is off the table. On Medicare, though, one part of the president's savings would come from increasing premiums to the wealthiest Americans, so there might be some agreement there. But raising the eligibility age for Medicare recipients is an absolute non-starter. The idea is unpopular, and it's also inefficient because it increases the cost to seniors without creating much savings to the government at all. Here's the bottom line in all of this. House Republicans have voted for Paul Ryan's budget twice, which turns Medicare into a voucher program. That's really what they want to do. I mean, if they had the power, that's where they'd go, and they're still holding that out. The idea is deeply unpopular with the American people in polls, and that has been shown time and time again. Republicans want these kinds of cuts, but they would rather pin it on President Obama than to take the blame. I say, bring it on. It does pencil out. Let's turn to Dr. Zeke Emanuel tonight, Senior Fellow at the Center for American Progress and Chair of Medical Ethics and Health Policy at the University of Pennsylvania, and one of the architects of the Affordable Care Act, which is now, of course, Obamacare. Dr. Emanuel, great to have you with us tonight.
Thanks for having me.
Sort this out for us. These $400 billion that's on the table with Obamacare or with Medicare that the Republicans deny cuts. Who's telling the truth here?
Well, the real issue is whether you're cutting things to beneficiaries or you're using those cuts to really transform the system to make it more modern. And I think, as they did in the campaign, is that they're trying to do now, they're trying to say, well, this will harm beneficiaries, but you can make cuts without harming beneficiaries. We at the Center for American Progress actually released a report where we had $385 million in cuts to Medicare and without taking it out of beneficiaries.
This is a valid proposal of savings of $400 billion.
Yeah.
But the Republicans, of course, deny that.
Well, you know, you can deny reality, but I think the president's put on a very bold proposal. And the really important thing I would say is there's one way of cutting, which is you just whack the system. You take money out, you make what you pay to doctors or hospitals less. That's going to be important to do. But the real interesting and important thing is to try to transform the system going forward so that year on year we're not spending, you know, increases well beyond inflation or the growth in GDP. That's going to be the key.
So part of the transformation here would be to allow Medicare to negotiate prescription drug prices the same way they do with veterans programs?
That's one possibility. There are various ways you can bring drug prices down.
But what would that do? If, let's say that it was similar to the veterans program, what would it do? How much money?
I'm not exactly sure what you could get, but we know that, for example, there's over $100 billion by getting payment for drugs from Medicare beneficiaries who are eligible, poor beneficiaries who are eligible for Medicaid, to get them in the Medicaid program instead of the Part D program.
Now, Dr. Emanuel, what happens if we don't have an agreement in Washington? We go off the fiscal cliff. What happens to Medicare? What happens to the beneficiaries?
Well, we're going to have a very big whack at the system, and it's not, I mean, the important point is it's not going to be strategic, and that is not a very good thing. And it's not just Medicare beneficiaries. Remember, in the sequestration, lots of other programs get hit. You're interested in biomedical research and the NIH? That gets hit. So you've got to be very careful here. Plus, the Republicans constantly say, well, we don't want to become like Greece. what's driving off the fiscal cliff make us look like? It makes us look completely irresponsible, as if we can't control our own spending and put in order some priorities.
So there'll be some real health care suffering if we go off the cliff, so to speak.
That's absolutely true. Okay. I would say the other important thing that we need to do is we want to incentivize doctors and hospitals to keep people well, not to just do procedures. And that is the key to really transforming Medicare.
All right, I want to show you a map of the states that are refusing to implement the insurance exchanges. It's rather interesting. The other states are either implementing the exchanges or haven't decided to do that. If states don't decide to do it and the federal government comes in and sets up the exchange, isn't that kind of a win for the move towards universal health care someday, because that infrastructure will be there?
Well, I think it provides people an option whether governors are refusing or not, and that's the most important thing, so that they can get access to good insurance products. It also, I think, takes away the claim that, well, the federal government is, usurping health care. The reason they stepped in is because states, forfeited their option to actually do something. I also think that we are going to have a very interesting set of experiments. California, Colorado, Maryland, and other states that are going to do this well are going to show the country, can you save money? Can you improve health outcomes? Can you give people options that they like? And I would look to those particular states as bellwethers, because they are really working on developing an exchange, running it well. The case of Colorado, interestingly enough, it's pretty bipartisan. You have people who want to make it work on both sides of the aisle, and so I think these could shame other states to come in. I also think, we should be honest. Out of 2014, it's, there may be some bumps in the road, but remember, this is for the long haul.
Yeah.
Right?
No doubt.
Out of the gate, it may not be perfect, but lots of software is not perfect right out of the gate, but we use it and love it, and it really helps us. And I think the same is going to help here. The exchange is going to help millions of people get better insurance products that are cheaper. All right.
Dr. Zeke Emanuel, thanks for coming in. Appreciate your time on the Ed Show tonight. Coming up, some Senate Democrats are trying to change the filibuster rule, and House Speaker John Boehner issues a threat. The nation's John Nichols will weigh in on that. And Republicans make their first post-election attempt at immigration reform. And just what did they do? They voted to limit legal immigration. Congressman Xavier Becerra will weigh in on that. Stay tuned. You're watching The Ed Show on MSNBC.